Welcome to another lesson by BeWell, shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. Hi. In this lesson, we will describe hardware and software technologies and requirements for activating telehealth services. LTs get started.
The term technological platform refers to the information infrastructure dedicated to the provision of telehealth services, integrated with the digital health ecosystem, for example, electronic health record, and interfacing with the national platform for the governance and dissemination of telehealth, to provide data useful for monitoring the use of telehealth throughout the national territory, and to verify the use of solutions included in the National Telehealth Catalog. For telehealth services, it is desirable to have a local technical organization, such as, for example, the service center or an issuing center for. This local technical organization intervenes when necessary, even proactively, remotely, or directly at the patient's domicile, for periodic maintenance and prompt resolution of malfunctions of the technological devices and instrumentation made available to the patient. The service center is responsible for managing and maintaining the information system through which the issuing center performs telehealth services, including the installation and maintenance of instruments at remote sites, patient's home or specifically prepared sites, the supply, management maintenance of communication means, including managing alert messages, between patients and doctors or other healthcare providers, training patients and their families in the use of these tools. The equipment necessary for the activation and maintenance of telehealth services in home care generally includes devices for recording, storing, and exchanging images, videos, and data, mobile devices, medical devices, and sensors for parameter detection, as well as the ability to connect and consult information among the services contributing to the telehealth process. The collection, storage, and consultation of health and socio-health information with health implications required for integrated home care are carried out through the use of the patient's home record and the synthetic health profile of electronic health record. Access to the platform of services and data contained in the clinical documentation, entered by various professionals or the beneficiaries/caregivers themselves, is allowed for the care team responsible for the person. Telecommunications play a fundamental role in telehealth services for the transmission of data and communication between the user, service delivery center, and potentially the service center. Interface. This refers to all systems capable of ensuring the connection and access of the user, service delivery center, and service center to the telehealth services network. Biomedical devices, hardware and software systems for acquiring and processing signals, images, data, including through mobile devices, smartphones, tablets, related to the user, suitable and compatible with telehealth services, medical devices. Web applications accessible through mobile devices, smartphones, tablets, for bidirectional transmission of healthcare information. Dedicated portals reserved for this purpose. Now we can focus on how to develop implementation specifications. Implementing telehealth is the process of translating utilization scenarios into features and functionalities to incorporate into a telehealth system. The specification of features determines the architecture, level of interoperability, its operational capabilities, expected impact and changes to established care workflows, and the technical potential to be integrated into a health system. Provider-to-provider telehealth, which integrates image and data sharing, electronic medical records, teleconferencing, medical equipment and software to assist lower-level health facilities with case management and carry out remote education, has relatively high upfront infrastructure investment and recurring maintenance costs. It also needs dedicated communication lines to perform services. Also, non-public facing, internet-based video conferencing tools, for example Skype, WhatsApp, Zoom, have been nominally free and easy to use in both forms of telehealth. The downside is mass market tools can neither be easily interoperable with provider information systems nor give control over patient privacy protection. Another key point is how to select technology partners. The user privacy and data security protection mechanism, transparency and function specifications, and service modules, in alignment with guiding principles, should also be included in vendor selection criteria. Previous project experience working with prevailing health systems, user experience and feedback, interoperability with provider systems, extensibility, ability to train and support for hospital site personnel should be given. User experience is not mentioned as often, but is no less important in ensuring provider and client adoption of telehealth services. The telecommunications system needs to provide a strong system of rules related to patient personal data protection, privacy, and informed consent in telehealth. As we will see in the upcoming lessons, this is a delicate and crucial aspect of the entire process. The telecommunications infrastructure must also ensure service operability through the adoption of telecommunications standards and interoperability of the networks and protocols it uses, continuity of service throughout the provision period, citizen safety by ensuring verification of the source of information, authentication, protection of information from unauthorized access, cybersecurity, which involves protecting networks and systems to prevent and/or detect intrusion attempts, confidentiality through specific technical solutions for profiling service users. If medical devices are used, they must comply with current legislation regarding safety and effectiveness, as defined in the community directives for the certification of medical devices and related guidelines. The Community Directive on Medical Devices defines medical device as software, the classification of which is addressed by guidelines, and its compliance with specific standards is deferred to vertical norms. Lastly, for ICT technology applications, infrastructures and software, that connect multiple medical devices, new recent guidelines are available to define the mutual responsibilities between dispensing centers, service centers, and medical device manufacturers, which refer to specific technology standards as well as informative criteria for clinical risk management. In the management of healthcare information, the use of prescribed formats and coding standards must be ensured according to the legislator's requirements.
This overview about hardware and software technologies and requirements for activating telehealth services helped us better understand what is behind the telehealth system, an important point to proceed effectively in the training course. Thank you for attention, and see you soon.